Uh, Good morning, good evening. Thank you, Chairman, for kind introduction. It's my great honor to have this opportunity to participate in this international dialogue on LHON and share our experience on the management of LHON patients in China. As we know, labor hereditary optic neuropathy, LHON, is a rare maternally inherited mitochondrial disease, resulting loss of vision in both sides simultaneously or successively. Although the systemic epidemiology data is not available in China, since China has a large population, so the absolute number of patients is larger than that of other countries and areas, which means rare diseases is not rare in China. Globally, about 90% of the cases are caused by the 3 major point mutations in mitochondrial DNA. And in China, 90% of LHON is caused by ND4, which was the most common gene encoding the ND4 protein that makes up mitochondrial respiratory complex 1. The prognosis of this mutation is worse than other 2 kinds of mutation. Its spontaneous recovery rate is lower than other 2, and in China the rate is even lower. In other words, more 11778 mutation patients in China means more worse patients in China. So the early diagnosis is very important. In order to achieve the goal of the early diagnosis, lots of work have been done. For example, in 2018, the National Health Commission issued the first batch of rare diseases catalog, and LHON is on the list. In 2019, the General Office of the National Health Commission further established the National Rare Disease Diagnosis and Treatment Collaboration Network. In the same year, Chinese consensus on diagnosis and treatment of LHON was published. And the next year, clinical practice guidelines for LHON was also published. These publications helped the Chinese ophthalmologists to diagnose LHON early and correctly. The flow of diagnosis and the treatment procedures of LHON was introduced to Chinese doctors as well. According to the international and the domestic guidelines and the consensus, this is the usual management protocol that we follow, DRTGFP. First of all, is the diagnosis and differential diagnosis. We need to educate our general ophthalmologists to be familiar with the clinical feature of the disease and have the ability to rule out other retinal and optical neural diseases. Refer the patient to the genetic disease clinic to see a specialist. In recent years, the widespread use of OCT has allowed us to find some characteristic changes of HLON on OCT, such as thinning papillomacular bundle retinal nerve fiber layer, usually thickening in the dynamic phase and thinning in the chronic phase. And the temporal nerve fiber layer thickness of the optic disc is significantly thinner. Of note, retinal ganglion cell complex, GCC, thinning at the early stage. Only for the patient Only for the patients with clinical suspicion of LHON, genetic testing will be performed step by step. Step by step, confirm the diagnosis. We have developed a rapid and sensitive method detecting LHON 3 primary mutations using CRISPR-Cas12a testing system. However, in China, genetic testing is only available in large cities, and it is quite expensive. So not all suspicious patients will be genetically confirmed. Patients in our hospital can be tested for free just because we have foundation funding. Once being diagnosed, these patients and their available family members will be registered in our database. The registration includes general information, clinical manifestation, and multimodal imaging. We have established an inherited retinal disease patients visiting project. All information is traceable. Concerning about the therapy, actually there's no available effective treatment in China at this moment. LHON is off-label in China, and the gene therapy is still under the clinical trials. Previously, Dr. Ding had already given us the details. After diagnosis of LHON, genetic counseling is quite important for the family. Male and female patients, how likely will their offspring get the disease, high risk or low risk? What is the pattern of inheritance? Will there be symptoms? How serious will be the disease, and what will be the prognosis? All these questions are the patients and their families may concern about all these questions. We need to answer them one by one. Regular follow-up of the LHON patients is also very important. For subacute and dynamic patients, we follow them every 3 months for the first year, every 6 months for the second year, and then once a year. For chronic patients, we follow them every 6 months for the first year and once a year thereafter. For a symptomatic patient, follow-up frequency is once a year. Follow-up assessments including visual acuity, visual field test, OCT, and OCTA. The prognosis of visual acuity varies with onset age and the genotype of mutation. Vision may decrease to worse than 20/200 in both sides, but rare to lose light perception. So low vision rehabilitation should be provided early. For those unaffected carriers, prevention is very important. Through patient education, we will tell them to avoid neurotoxins such as tobacco and alcohol, as these may increase oxidative stress. We will tell them to avoid staying up late, to avoid the stress and the anxiety, to avoid the trauma, and so on. So that's the flow of management procedures of LHON in our hospital. It may also represent the management process of this disease in certain hospitals in China. Finally, I would like to thank Jie Chong and Junlan, who contributes lots in our hospital in the genetic disease clinic. So thank you for your attention.